Imagine waking up one morning and realizing that something as simple as opening a bottle, climbing stairs, or even getting out of bed has become a painful struggle. What if I told you that over 350 million people worldwide are living with a condition that slowly attacks their joints, steals their mobility, and can dramatically change their quality of life? Most people think arthritis is just a disease of old age, but what if that's completely wrong? What if arthritis can affect children, young adults, athletes, and even people who appear perfectly healthy? And what if some of the everyday habits you're doing right now could be silently increasing your risk? Today, we're uncovering the shocking truth about arthritis, the warning signs, the causes, the different types, and the simple steps that could help protect your joints before it's too late. Stay until the end, because we'll reveal one symptom many people ignore that could be the earliest warning sign of arthritis. What exactly is arthritis? When most people hear the word arthritis, they think it refers to a single disease. But arthritis is actually an umbrella term for more than 100 different conditions that affect the joints and surrounding tissues. A joint is where two bones meet. Your knees, hips, shoulders, fingers, ankles, and elbows all contain joints that allow movement. In a healthy joint, cartilage acts like a cushion, helping bones glide smoothly against each other. But when arthritis develops, that protective system begins to break down. The result? Pain, swelling, stiffness, reduced mobility, and in severe cases, permanent joint damage. Some forms of arthritis develop gradually over many years. Others can appear suddenly and progress rapidly. That's why understanding the condition is so important. The most common types of arthritis. Osteoarthritis. This is the most common form of arthritis. Often called wear and tear arthritis, it happens when cartilage gradually breaks down over time. Without enough cartilage, bones begin rubbing against each other. This causes pain, stiffness, and reduced movement. Commonly affected areas include knees, hips, hands, lower back, neck. Rheumatoid arthritis. Unlike osteoarthritis, rheumatoid arthritis is an autoimmune disease. This means the immune system mistakenly attacks healthy tissues. Instead of protecting the body, it targets the lining of the joints. Over time, this can cause severe inflammation and permanent damage. Rheumatoid arthritis often affects both sides of the body. For example, both hands or both knees may become painful at the same time. Gout is one of the most painful forms of arthritis. It occurs when uric acid crystals build up inside joints. The pain can strike suddenly, often at night. Many sufferers describe it as feeling like their joint is on fire. The big toe is a common target, but gout can affect other joints as well. The early warning signs most people ignore. One of the biggest mistakes people make is assuming joint pain is normal. It isn't. Your body often sends warning signals long before severe damage occurs. Watch for these symptoms. Morning stiffness. Do your joints feel unusually stiff when you wake up? If stiffness lasts longer than 30 minutes, it could be a warning sign. Joint swelling inflammation can cause joints to become enlarged and tender. Reduced range of motion. You may notice difficulty bending, reaching, or gripping objects. Clicking and grinding sounds. When cartilage wears away, joints may produce unusual noises. Persistent pain that continues for weeks or months should never be ignored. Fatigue. Certain types of arthritis can make you feel exhausted even after adequate rest. This symptom surprises many people because they don't associate arthritis with tiredness. What causes arthritis? The causes vary depending on the type. However, several major risk factors increase your chances. Aging, 14-4. Years of joint use gradually increase wear and tear. Genetics, family history can play a major role. If close relatives have arthritis, your risk may be higher. Obesity. Excess weight places enormous stress on weight-bearing joints. Even a few extra kilograms can significantly increase joint strain. Previous injuries, sports injuries, and accidents can damage joints and increase arthritis risk later in life. Autoimmune disorders. Certain immune system abnormalities can trigger inflammatory arthritis. Lifestyle factors. Smoking, poor diet, and lack of physical activity may contribute to disease progression. The hidden dangers of untreated arthritis. Many people delay treatment because they believe arthritis is simply a normal part of getting older. That assumption can be dangerous. Untreated arthritis can lead to chronic pain, severe mobility problems, joint deformities, muscle weakness, loss of independence. Some inflammatory forms can even affect the heart, lungs, eyes, blood vessels. This is why early diagnosis matters. The sooner arthritis is identified, the better the chances of slowing progression. Can arthritis be prevented? While not every form of arthritis can be prevented, many healthy habits can reduce your risk. Maintain a healthy weight. Less weight means less stress on your joints. Stay active. Regular movement helps strengthen muscles that support joints. Walking, swimming, and cycling are excellent options. Eat anti-inflammatory foods. Focus on fruits, vegetables, fish, nuts, whole grains. Protect your joints. Use proper lifting techniques and avoid repetitive strain when possible. Stay hydrated. Water helps support overall joint health. Avoid smoking. Smoking increases inflammation throughout the body. Modern treatments are changing lives. The good news is that arthritis treatment has improved dramatically. Depending on the type and severity, doctors may recommend physical therapy exercise programs, weight management, pain-relieving medications, anti-inflammatory medications, disease-modifying drugs, joint injections, surgery in severe cases. Many people with arthritis live active, productive lives when they receive appropriate treatment. The key is seeking help early. Conclusion: arthritis is far more than occasional joint pain. It's a complex condition that affects millions of people worldwide. The warning signs often start small: a little stiffness, a little swelling, a little discomfort. But those small symptoms can sometimes signal a much bigger problem developing beneath the surface. The good news? Knowledge is power. Understanding the symptoms, risk factors, and treatment options can help you take action before significant joint damage occurs. If you've learned something new today, don't forget to like this video, subscribe to the Health Files, and turn on notifications for more fascinating health documentaries that could change the way you see your body. And here's today's question. Have you or someone you know ever experienced arthritis symptoms? Share your story in the comments below, because your experience could help someone else recognize the warning signs before it's too late.